So as many of you may have guessed from my title, today I'm going to be talking to you about the flu. And I want to start off my speech by letting you listen to a very short audio clip by DeGeneres. And during the clip, I want you to consider if her statements resonate with you and if you've heard or made similar arguments when discussing the flu and the flu shot.
I haven't gotten a flu shot, and I'll tell you why. Because you know what's in the flu shot? Flu. And you know what's in the needle? Needle. I never got a flu shot growing up. I was raised Christian Science, and if you don't know what that means, we didn't believe in medicine. We didn't go to doctors. We couldn't even wear Dr. Scholl's. I couldn't even have that. Fortunately, I was only sick once when I was little. I got a cold when I was 5, and then I was better when I was 17.
So what did you all think of this short piece? I promise I'm not going to bite, so you can just go ahead and raise your hand. Okay, well, have any of you actually gotten the flu shot this year? Raise your hand if you have. Very good. Have any of you thought about getting the flu shot, but you decided not to because you were afraid, you thought it might hurt, or you might get sick from it? Okay. So, many of you have probably had the flu, or some of you have even gotten the vaccine for the flu, and maybe you've had a medical professional talk to you before. This topic relates to me personally as I'm a pharmacy technician, so one of my jobs is preventative care. So I get to promote the flu shot and teach people how this can help them during the flu season. And today I'm going to share this knowledge with you. I'm going to explain the dangers of the flu and how to protect yourselves and your loved ones from getting the flu. So what's the problem with the flu? Well, the flu is defined by the CDC as a contagious respiratory illness caused by the influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild illness in some to very severe up into death. And this isn't even the worst problem of the flu. The virus itself can lead to many complications that are very deadly, including pneumonia, sinus infections, and congestive heart failure. And no one's immune from the flu itself. So anyone, regardless of age, sex, or current health conditions, can get the flu every season. But our more impacted communities are adults over the age of 65 and children under 5 years of age. So this is maybe yourselves, your parents, your grandparents, or even your children. And for you specifically as students and working professionals, the Huffington Post says that over 100 million workdays are lost to the flu every year, and an average person will miss between 3 days up until a week of work. So you can imagine it's very stressful when you're already not feeling good. You're going to have to catch up from missing 3 days or maybe even a week. And now that we've talked about the general problems of the flu, let's talk about this year. And one of the best ways to do that is talk about it comparatively against the previous flu epidemic. So in 2009-2010, we had the H1N1 virus. This year, our predominant strain is the H3N2. So as some of you may remember, or maybe your parents do, this one in 2009 was known as swine flu, and it caused over 16,000 deaths worldwide. This year, we've seen over 60 deaths in children, and we have an untotaled number of total deaths. So if we look at the hospitalization rates, which this was gotten off the CDC website, you can see this gray line to the far right. This is the hospitalization rates in 2009-2010. The middle red one, that's this year. So we are almost peaking the highest rates that we had in swine flu, and we are not through the season. So these rates are expected to grow. We're going to see more people going to the hospital, more people having these complications, and more people dying from it. So the CDC and the World Health Organization, their best recommendation when it comes to the flu is to get your flu shot. And the flu shot has many benefits. First and foremost, it does do flu prevention. So the flu shot works with the vaccine that has a dead version of a flu virus. When it goes into your system, your body learns how to recognize it and fight against it later. So this cannot give you the flu, but when you're at work or you're at school or you're out with your friends, if any of them have become infected with this virus, they can't give it to you. Your body knows what it's looking for. If you run across a different strain of flu, because there are many different viral strains, it can mitigate flu symptoms. You can think of an influenza virus as like brothers and sisters and cousins. They're all related, they have things in common. So if you have the flu shot and you end up getting the flu anyway, your body is very quickly recognizing what it's up against, can mount an immune response, and get you over those symptoms a lot quicker. So you'll be back at work, back at school, and back with your friends. And lastly, it's really important that you get the flu shot for your loved ones. So vaccines work by herd immunity. And this diagram is a very good explanation of it. So those red dots are people who got unvaccinated or they're high-risk patients, so they weren't as affected. In the middle, we have those blue dots. Those are the people who chose to get vaccinated. The flu can go and infect unvaccinated people, and they can spread it to others. If you have the flu vaccine and your family has the flu vaccine and more people have it, we can create bubbles around them, limiting exposure of the flu to others and limiting its spread and effect. But you can see if any one of those blue dots, those people chose not to get the vaccine, we'd be leaving our high-risk patients even more exposed and more likely to have these damaging symptoms. So now that we've seen why you should get the flu vaccine, let's talk about why it's affordable and accessible to everyone here. So where do you get it? You can get it at your primary care physician or a local retail pharmacy, and most insurances cover the flu shot. And another really great benefit if you're a university student or faculty member is that university healthcare services usually offer the flu shot for free at the beginning of every season. So if you have any questions, you can always contact your local healthcare center, and for us that would be Nurse Alice and Kennedy Newman. So in conclusion today, I've shown you how the flu can impact yourselves and others and how to prevent or minimize the effects of the flu by getting the flu shot. Protect yourselves and others today. Go get the shot.